And this is Good Morning Scotland. Let's talk about that bowel cancer story that I mentioned just a minute ago in the headlines. This is groundbreaking specialist scans, which we're told could revolutionise how doctors diagnose and treat bowel cancer. Scientists in Glasgow have developed a way of experts examining the whole bowel instead of using the traditional biopsy. They can monitor the cancer's progression in a non-invasive way. David Lewis is from Cancer Research UK. Morning to you, David.
Good morning.
Well, let's just talk about what happens at the moment with biopsies being taken and how difficult that can be for patients and potentially for medics too.
Yeah, biopsies are a traditional way of diagnosing a lot of tumours, but they rely on getting access to the tissue, and that itself can cause some problems such as bleeding or infection and can be quite uncomfortable. So we are looking at ways of being able to diagnose cancers without having to take those biopsies, and that's particularly important if you have a cancer that's perhaps spread already around your body and you can't get tissue from all of those areas.
So tell us about this scanning and how revolutionary it potentially could be.
So the work that we've been doing in Glasgow is developing a scanning technique called PET imaging, and it uses labelled molecules. So we often use a labelled sugar, which goes around the body. We inject this into patients, and that lights up areas of the tumour. That is routinely done in cancer at the moment. But what we've done in Glasgow is to look at new molecules. So not in addition to sugar, we can look at things like fats and amino acids and see how they're distributed in the body as well. That's really important because we know that tumours, in addition to consuming lots of things like sugar, also have consumed other nutrients, and we can see because of the patterns of those uptake different types of tumours, and we were able to link that closely to the genes and the genetic mutations in those tumours to give a much more complete picture of the types of tumours that we could see.
Non-invasive, but does it also give a faster diagnosis?
You need to get the scan, so it does take a little bit of time to do that. But we're more interested in accurate diagnosis, so not just being able to see where we can see it very quickly, but whether we can get a complete picture so that we can then guide treatment effectively.
And how big an issue is bowel cancer in Scotland?
Yeah, it's a real big problem. So it's about the third most common cancer in Scotland. So about 1 in 20 people will get bowel cancer in their lifetime, and unfortunately, about half of those patients will die. Thanks to kind of research that we've been doing and others in CRUK, the incidence is going down. However, bowel cancer is going up in younger people, and we're not quite sure all the reasons why that is. So it still remains a really big issue.
And when it comes to doing these scans, do you need specialist equipment, and is it widely available at this stage?
So there's in Scotland there's several PET centres, particularly in Glasgow, Edinburgh, Dundee and Aberdeen. With partners in Edinburgh, we're setting up a new national facility for a new type of PET scanner. So this is a PET scanner that covers the entire patient, and that will be opening in autumn this year. And so we're hoping to be able to drive forward a lot more of these research programs through that new technology. It's much more sensitive than the current techniques, and so we hope to be able to do many more things with it.
What sort of stage are you at the moment? How readily can you roll this out?
So it's still at the early stages. This is the first time that we've been able to demonstrate that we can use this technology and align it to particular features in patients' tumours. That is really going to change the way that we treat these tumours, because we can start to identify individual differences. But we need to really roll this out and try it in clinical trials to determine that is going to be effective. But it's hugely exciting that we can start to diagnose individual differences in patients, and then the ultimate aim of this will be to guide those patients onto specific individual therapies.
And what sort of treatment is used at the moment? Is it more of a blanket treatment?
Yeah, I mean, so chemotherapies are frequently used in tumours, but what we're trying to advance with other people is much more friendly, targeted treatments, which target specific differences that might be in your tumour. So one thing we've learned, particularly over the last 10 to 20 years, is that all tumours are different. But so understanding that critical information can really help guide treatment. So we need to be able to target those things specifically.
And does this have applications beyond bowel cancer?
Yeah, we're developing PET imaging for multiple areas, including things like lung cancer, and really because it can image the entire body, it's not restricted to one particular tumour type. So again, these ideas that we're trying to advance them in all cancers. So I think that'll be hugely exciting.
Well, fascinating, and we wish you well with all of that. Thank you very much indeed for coming on and explaining it to us this morning. David Lewis there with Cancer Research UK.
8 minutes.